When I tested positive, I was very troubled and afraid because I never expected that I would be HIV positive.
Mothers to mothers.
I went through pregnancy without knowing my HIV status, and by the end of the day, I had transmitted the virus to my son.
And the terrible tragedy of it is it's completely unnecessary. There really isn't a reason why a single baby should be born infected today. We have fewer babies born in the US, the UK, and Europe combined in a year than in a single African clinic. It's unacceptable and it's unnecessary.
Each year, 1.5 million pregnant women worldwide are living with HIV and risk transmitting the virus to their unborn babies. Yet the transmission of HIV/AIDS from mother to child is entirely preventable with the proper medical intervention, nutrition, and education. The prevention of mother-to-child transmission of the virus is the idea behind a nonprofit organization called Mothers to Mothers. New mothers living with HIV are trained as mentor mothers and work alongside doctors and nurses, providing critically needed education and emotional support to newly diagnosed pregnant women. Through one-on-one and group meetings, mothers are taught about everything from life-saving medical interventions to reproductive health, domestic violence, disclosure of their status, and feeding options for their infants.
It's broken on so many levels. We have so many challenges. But for us, we believe that prevention is the best place to start. If we can keep babies from getting infected, we don't have to worry about treating them later on.
From what was once a small grassroots startup in Cape Town, Mothers to Mothers has now grown to almost 700 sites across 7 sub-Saharan African countries, employing more than 1,600 HIV-infected mothers to mentor over 300,000 pregnant women and new mothers each year.
Call them at any time. We have a problem here. These 2 mothers, they'll come, they'll take that patient at a private room, they'll discuss, and they'll give proper advice.
I feel that I make a difference to women when I talk to them because I am also HIV positive, and talking to them and supporting them, telling them my own example on how I went through the program and on how I've managed to get knowledge and share with my family helps them also to get encouraged. I think that without Mothers to Mothers, my baby would have been HIV positive by now, because I wouldn't know what to do to prevent the transmission of HIV from myself to the baby. So it's through Mothers to Mothers that I've been able to get that support, to get that guidance, and that's why my baby is now HIV negative.
Mothers to Mothers,
Mothers to Mothers has helped me to look after myself, to look after my children in terms of infant feeding. Mothers to Mothers has also helped me to look after myself in terms of avoiding reinfection from my partner, and also the importance of disclosure of my HIV status, and in general how to cope and live positively with HIV.
They all have meaning. One song could be about the importance of exclusive breastfeeding. One could be a song about family planning and singing about how we all have a lot of children. We have to make sure to feed and take care of them. So let's practice safer sex and let's practice family planning. So there's a good reason for all of the songs that we're singing, and it's all part of the educational and empowerment process of Mothers to Mothers.
Born in 2001, the idea behind Mothers to Mothers is striking in its simplicity. Paying mentor mothers creates role models who, by example, fight stigma in their villages and communities. The results? Babies born without HIV and extended families seeking out medical care. It's a program that inspired philanthropists like Debbie Bickerstaff to become a major benefactor.
It just didn't seem fair to me that the women in the United States had all of the information and the testing and the medications, but yet the women in Africa did not have that. They didn't have access, and that's what they really needed. They needed the information to make better choices for themselves and their babies, And the best way that I could help were with the resources that we had, and that was in donating to the Mothers to Mothers program.
Mothers to Mothers vision is a world with healthy babies that are free from HIV, with mothers who stay alive to raise them, and with communities that are free of the stigma that keeps mothers from making healthy choices.
Since I joined Mothers to Mothers and I got employed and I get a salary, my life has changed because I'm able to look after my children, to buy whatever they want. I'm also able to look after myself, buy whatever I want. But apart from the money that I get from Mothers to Mothers, I also get satisfaction by working with my colleagues as a team, because before I was isolated, I was just sitting at home. Through Mothers to Mothers, I've been able to learn how I can look after myself despite being alone, how I can look after my child so that she does not contract the HIV virus. And it's through Mothers to Mothers that I've been encouraged to go on without fear despite my HIV status.
Overall, Mothers to Mothers is having a huge impact in the number of babies that are being born negative, and to the mother having a hope for the future, that she can actually stay alive and see that child go into kindergarten, see that child go into high school. Hope for people living with HIV in Africa is something that's very new, and it's very special, and it will pave the way for a healthier future for these children.
If I never met Mothers to Mothers, I would have been still afraid of my situation, and I wouldn't have been as healthy as I am right now.
The transmission of HIV/AIDS from mother to child can be prevented, and Mothers to Mothers believes that mothers are the single greatest resource we have available to combat HIV/AIDS in Africa. We can prevent an entire generation from HIV infection in our lifetime. For more information, visit m2m.org.